So here's a question I bet a lot of you have had. Can taking antibiotics actually make your birth control stop working effectively? It comes up all the time, and if you try to look it up online, forget about it. It's just a mess of conflicting advice. It's
Ah,
confusing, right? And honestly, it causes a lot of unnecessary stress. So today, we're going to really dive deep into this whole thing, this widespread misconception. We're using a great analysis from Professor Lin to try and cut through all that noise and get to some clear answers.
exactly. And, our goal here isn't just to give you a yes or no answer. It's really about something bigger. We want to help you understand how to look at health information critically. We'll unpack the science, look at studies that seem to disagree,
Yeah.
and hopefully equip you with the tools to tell, solid fact from maybe just rumor, especially in the biomedical world.
Okay, let's get into it then. The common belief, the one you hear all the time, it's that many broad-spectrum antibiotics, the really common ones like penicillin, erythromycin, cephalosporins.
Right. Sulfonides, Bactrim, chloramphenicol, the usual suspects.
Exactly. The idea is they might mess with your birth control's effectiveness. And the theory you often see, like from sources maybe like Smilerfix, is that these antibiotics reduce the good bacteria in your gut, the gut flora, which are apparently needed to absorb the hormones properly.
It sounds pretty logical on the surface, doesn't it? Like antibiotics affect gut bacteria, hormones need absorbing. It connects. That's why the idea spreads. But, and this is where it gets really interesting, the big health organizations, we're talking the World Health Organization, the WHO, and the US CDC,
The major players.
the major players, they have a very clear stance. They explicitly state these common antibiotics do not reduce the effectiveness of hormonal birth control, that gut flora theory. It's just not backed up by the large-scale evidence.
Okay, so if that theory is mostly debunked by the big organizations, why does the myth hang around?
Yeah.
And are there any antibiotics we should be concerned about?
Ah, yes. That's the crucial part. The broad myth is false, but it doesn't mean no antibiotics interfere. There are specific ones that do, but it's for a totally different reason. Nothing to do with gut flora, really.
Okay, here's where it gets really interesting then.
Right. The University of North Carolina explains this well. We need to talk about enzyme-inducing antibiotics. These drugs literally speed up how your liver breaks down the hormones and combine contraceptives. The pill, the patch, the ring.
They accelerate the breakdown so the hormones don't stick around long enough to work properly.
Precisely. Makes them less effective. And there are three main ones to know: rifampin, rifabutin, and grisofulvin. Those are the ones that are actually proven problematic.
Rifampin, rifabutin, grisufulvin. Got it.
Yeah.
But wait, this brings up something else because I know there's been some debate, even in academic circles. Wasn't there a blog post like back in 2020 in the BMJ, the British Medical Journal, some doctors, Aronson and Ferner?
Yes, exactly. Doctors Jeffrey Aronson and Robin Ferner. They published a blog post arguing against the standard UK guidelines. They were suggesting that even the non-enzyme inducing antibiotics, the common ones we just said were okay, actually did pose a risk.
Well, okay, so they were challenging the WHO and CDC stance directly. That's a big claim. Did they have data?
Well, that's the next step. This raises a really important point about evaluating evidence. In 2021, they followed up with a formal paper. They'd analyzed UK regulatory data, reports of suspected drug reactions, and their conclusion was pretty startling. They said common antibiotics were linked to a 7 times higher chance of unintended pregnancy compared to other drugs used as a control.
7 times higher. Okay, that
Exactly.
sounds significant. If that study holds up, it changes everything we just said.
So how did the scientific community react? What did bodies like the FSRH in the UK or the FDA over here say about that paper? The reaction was pretty swift and critical, actually. And it's a perfect example of critical thinking in action. The UK's Faculty of Sexual and Reproductive Healthcare, the FSRH, immediately put out a statement. They said the Aronson and Ferner study had, quote, many limitations and wasn't strong enough scientifically to make them change their guidelines.
Okay, limitations like what? What was the problem with this study?
Well, a later review, this one in 2023 by 5 US FDA researchers, really dug into it. They pointed out major issues. Firstly, its retrospective design. It looked back at old reports, which can be unreliable. That's recall bias. People may misremember or misreport things. And they also cited a lack of supporting data, basically saying the evidence just wasn't robust enough to support such a strong conclusion.
So methodological issues essentially undermine the finding.
Exactly. And crucially, the big organizations like the WHO and the US CDC and the CDC guidance was updated as recently as November 2024. They haven't changed their stance. They've looked at the evidence, including studies like Aronson and Ferners, and concluded the existing guidelines are still correct. No change needed. It really shows how one study, even if it makes headlines or appears in a good journal, doesn't automatically overturn years of established consensus, especially if the methods are shaky.
Right. That makes sense. You need a strong body of evidence, not just one potentially flawed study. So let's bring it all back together. After looking at Professor Lin's analysis, the consensus, the debate, what's the bottom line for you, the listener?
Okay, the clear, actionable takeaway is this. Unless you are prescribed rifampin, rifabutin, or grizafulvin. If you're using hormonal birth control pills, patch, ring, implants, injections, you can generally take other common antibiotics safely without needing to use backup contraception like condoms.
That's much clearer. So for the vast majority of antibiotic courses, it's not something you need to add to your worry list.
Correct. Obviously, always talk to your doctor or pharmacist if you have specific concerns about your medications, but the general rule holds.
This whole deep dive really shows how important it is to look closely at health claims, doesn't it?
Hmm.
To separate the solid evidence from maybe just speculation or a single outlier study. It's definitely encouraged me to be a bit more investigative.
Absolutely. And maybe that's the final thought to leave you with. Next time you come across a health claim that sounds surprising, maybe about a medication, maybe about a diet fad, whatever it is, just pause and ask yourself, is this based on the weight of the evidence? Or is it maybe just one piece of research, perhaps with its own flaws or limitations? Being critical is key.